For restorative hand, we want a nice, gentle curve. For orthopedic, you may want straight out, but the restorative conditions are totally different. You're dealing with nerves and shortened tissue. We want to be able to flex through any tone, and it has to be comfortable. We don't want to overextend the thumb, stretch it. The web space is very, very tender, and it requires going very slow. You want a nice curve at the fingers so they can pull through tone, otherwise they'll tend to shoot over or ball up. And you want the wrist to not be overstretched. So we're going to heat mold for wrist flexion. You want to keep moving the kydex. You want to heat an area, not a spot. These are polymer chains that you have to warm, and it will stretch. If you try to just bend this type of plastic over a sharp object or a table, it will fracture those polymer chains and they'll eventually fail and break. Okay. I use my hand to simulate what the patient is doing before I try it on them. So I'm going to just bend down a nice curve, not a sharp angle, but a nice curve. And what I want to do is just put a nice passive stretch on the patient's joints. We always think correction and that just mild stretch with the flex, because after it cools it will maintain its memory but still have flex. That's for the wrist. Now we're going to do thumb adduction. Again, you heat the area back and forth, just till it is pliable. Then you're going to mold it down. You want to support the thinner eminence. That's a big problem with all restorative patients of any age. I'm going to mold it in just to where it gives passive stretch. This is my favorite splint, and I use it exclusively unless there's not enough space to mold the thumb in. It's just too tight, and then I would go to the thummies, or if I had it closed to a moderately closed palm or severe wrist tone, and then I would probably use the flex hand. To remold this back out, you heat it again and just bring it back out at the patient's comfort level. To mold for more severe finger flexion, again, just mold back and forth both sides of the plastic just until it softens. Be careful to always wear gloves and protect the heat source, everything from the heat source, anything flammable, and certainly never get it near your patient. Again, I'm going to bend those fingers down. You just want mild stretch on them. You want it comfortable, but just to put a mild stretch. If the patient is in pain, they won't wear it, and you're not doing good therapy and stretching. We want a nice curve. If the MCPs are flat, mold it to where they have a little bit of curve, and then you will gradually remold it back as the patient improves.